My sincere appreciate to Pit Perdami 2023. Thank you for giving me the chance. My name is Steve from University Pajajaran. I would like to present a case report about augmented surgical treatment in patients with partially accommodative esotropia. As an introduction, residual esotropia more than 10 prism diopter is distance and near fixation that exceeds this despite the full correction of hypermetropia. That is called partially accommodative esotropia. Partially accommodative esotropia has associated with a high accommodative convergence per accommodation ratio, can be characterized as having a high hyperopic refractive error, a near deviation exceeding the distance deviation by 10 prism diopter, and an onset between the age of 6 months and 5 years of life. The esotropic angle responds only partially to reduction in accommodation effort through full hyperopia, and the non-accommodative part is managed surgically. The standard surgical treatment has been to operate for the residual esotropia measured in the distance while wearing full hypermetropic correction. The purpose of this study is to report a case about augmented surgical treatment in partially accommodative esotropia patient. This case report was about an 18-year-old girl comes to hospital with vision loss in both eyes since 1 year prior admission. The ocular alignment cine correction was 30° and cum correction was 15°. Recent alternate cover tests showed deviation in cine correction in near fixation about 60 prism base out, and for distance fixation 50 prism base out. And for the deviation in cum correction with near fixation is 40 prism base out, and distance is 35 prism base out. So for this patient, using surgical formula with augmented surgery was for the near correction. It is about 60 prism base out with cine correction for near fixation and 40 prism base out for cum correction with near fixation. Divided by 2 equals to 50 prism base out. So the patient was diagnosed with compositous hypermetropia and also partially accommodative esotropia. The patient underwent bilateral medial rectus recess on 2021. The first reinsertion of the medial rectus was carried out by 6 mm on the right eye and also the left eye. For the post-operative day 1 result, examination of the eyeball position in cine correction was orthotropia, and post-operative day 1 week position of the eyeball cine correction was esotropia 7°, and for the cum correction were orthotropia, where the prism alternate cover test cine correction was 40 prism base out. This examination also showed the same at post-operative day 1 month, and for the post-operative day 2.5 months, show cine correction with 7°, and the cum correction was orthotropia. For the prism alternate cover test with cine correction 10 prism base out, and the cum correction show orthotropia as seen in the figure 3A and 3B. For the result, ophthalmology examination after 1 and 2.5 months, surgery show ocular alignment on without spectacles, show microtropia, and in cum correction show orthotropia. For the discussion, as various approaches can improve outcomes, including using different surgical formulas, augmented surgery are the mean of deviation with and without the correction as the final deviation surgical formula. For standard surgery is a procedure in which surgical management of residual deviation with far-reaching correction. However, the standard surgery has drawbacks, namely under correction up to 25%. For the augmented surgery, it has, compared to the standard surgery, was 93% success and 7% overcorrection. As the conclusion, the amount of surgery in strabismus was based on the size of preoperative deviation. For the augmented surgical treatment can be one of the choices to determine preoperative deviation in esotropia patient. I truly appreciate for your attention. Thank you.